Hello, hello. Good morning. Good morning, everybody. Great to hear so much conversation. Today is going to be all about conversation, whether you're going to be hearing it from the stage or having those very important conversations over the breaks. So lovely to see so many people here today. As you know, this is about conventional versus longevity medicine, which is a very interesting subject. And I'm sure many of you are going to be passionate about that today, and I know many of our speakers are too. So if you don't know me, my name is Phil Newman. I'm the editor-in-chief of longevity.technology, and I've been absorbed in this space since 2018. In fact, I figured that there was going to be a very interesting momentum behind a next generational move into what was happening in healthcare. And I think it's fair to say, by the number of people that are here, and probably your gut feel, that this industry is now really arrived. It's arrived, it's still early. As we know, the industry doesn't have standardized protocols across the industry, but we're going to hear about standardized protocols today. There's interesting discussions about, is a longevity clinic a diagnostics-only clinic, or is it a diagnostics and interventions clinic? And of course, all of this is against the background of what's happening commercially with the space. So as we know, there are a lot of longevity clinics cropping up around the world. We actually analyzed them. We've got over 300 now in our data sets. And quite interestingly, they've collectively last year, they attracted $500 million plus of investment. So you can see that money's coming into the space, standards are required in the space, and what we're going to be talking about today is how we as an industry, as part of the longevity phenomenon, which is both biotech as well as complementary, but very, very importantly, requiring clinics to be that pivot point for all of those people, those consumers that are interested in their own longevity. Maybe they've seen Brian Johnson, maybe they've had an age test, maybe they need guidance, and that's of course what we're all about as an industry. So the longevity clinics layer in the industry is going to be supremely important, and we're going to be learning a lot today about nature versus nurture, the power of mushrooms and psychedelics, and as I mentioned earlier, longevity protocols. So Ash is going to be sharing with us one of his longevity protocols, which I'm really excited about hearing. And another one that we're going to be talking about is democratizing longevity. So when I speak to other journalists and people in the industry, people of course are concerned that this is an industry for the 1%. Now, we all know that potentially the 1% are the people that are the early adopters of some of the great work that you guys are doing, but the reality is that democratizing access is so important to the therapeutics, the diagnostics, the interventions, to help people live longer, but more importantly, healthier lives. And we're going to hear about democratizing longevity, which I'm, again, very, very interested in learning about. So we have, as you can see in the top left-hand corner, if you were able to go to menti.com and put in that code, that gives you the ability to pose questions as we go through the speeches and presentations today. So if there's time at the end of each presenter's session, I'll be asking those questions on your behalf. But likewise, if we don't have time, there are going to be 2 Q&A panel sessions today where we'll have an opportunity to explore those questions that you've got. So obviously you can see there's access to the Wi-Fi there if you haven't got a signal. So go to menti.com, pop in that code, and then we can start getting your feedback. And obviously we will run the traditional running around with microphones to make sure we also get some questions as well. So, none of us would be here today if it wasn't for Dr. Ash Kapoor. What the team have done is phenomenal. Obviously, a great number of sponsors and supporters for the event, so thank you all for your support and going to the effort of bringing your products and services out into the foyer there. That's wonderful to see. And Ash is going to be talking to us about nature versus nurture, which I think is a very important baseline for many of our stressful lives and the lives that we lead. So let's get started. Ash, are you ready to come and join us? Okay, let's go. Please welcome Ash.
Thank you, Phil. Great. So a very warm welcome. Thank you for coming, particularly on a Saturday. Before we look at the sort of theme of the conference, that is longevity versus convention, a big thanks to Phil. We're very lucky to have him as a chair and a master of ceremonies, particularly with his perspective on global longevity. I think it's very difficult when you're sort of in the job doing things, but sometimes it's nice to have someone who can show you where you're going. And also having this global perspective is really important. So we're very fortunate to have him. The organisers, I'm really grateful for the team. There's so many moving parts in getting something like this sorted out. So the sponsors, Zainab and the media team, as well as the Levitas support team, Stephanie and Manny. So very grateful. My background is predominantly as a frontline clinician. It's been 35 years now. And in that 35-year span, I'm still a GP. I look after community hospitals. I've done out of hours. I've also been a GP trainer for about 25 of those years. It's given me an insight on what's going on in the medical profession through that period of time. As with anything in medicine, if you're there long enough, you get dragged into the transformation initiatives and the politics. So I've sat on a few boards to understand the direction of travel. But I have to say, the last 10 years of that career, I migrated into longevity. It wasn't called longevity then, it was just trying to do the right thing by the patient. It's now moved on. But that, I have to share a conflict of interest, that's where my passion is. So although I have to try and stay objective between convention and longevity, that is definitely where my passion is. So today, what I was hoping for is for you to have an insight into longevity medicine as an alternative to the traditional system. It is confusing because there's so many sort of variations of longevity out there: precision medicine, integrative medicine, biooptimization, which was biohacking, and cellular medicine. But they all are saying the same thing, and we're going to explore those today. So the objectives today essentially is to look at convention versus longevity, and we're going to look at two things: the guiding principles between how we practice medicine at the moment, and also the outcomes. And we can compare both. And then, as Phil said, we're going to have speakers talking about the offerings, but also a global perspective about how different countries are operating in the longevity field. This is really important because the offerings you're going to hear today are literally less than 1% of the opportunities in longevity. And I think it's really important that we don't want to complicate this field by creating a matrix of things that people run to without having a pathway. So towards the end, I'll talk a little bit about a pathway that we can apply all these wonderful things in an ordered manner to get the best outcome. So starting with convention, the guiding principles are based on very much symptoms. Patients come to you with a set of symptoms, and doctors are rewarded in making a diagnosis. And they often use tests to come to that diagnosis. More lately, however, we're finding that the symptom addressing is not happening, and people are just using diagnostic tests to come up with that diagnosis. So we're testing a lot more, and we're looking at MRIs, CTs, and not really looking at the patient, which is a shame. Now, with that, we've made 126,000 diseases. The ICD code, there's 126,000 of them now. And that's complicated because with that number of disorders, our young doctors, or all our doctors, are trying to work out which one applies to the patient. And of course, we don't live in silo medicine. We're one integrated unit. So the fact that the diseases are getting higher and higher is actually causing a great deal of discomfort to the profession. It also means that patients don't get a global treatment. They simply just get their diagnosis managed by probably a drug. So the treatment pathway is very much pharmaceutical. We're now moving into another field called pre-symptoms, so a pre-symptom situation, so pre-diabetes, pre-hypertension, pre-metabolic disorders. And those 126,000 diseases are probably going to double. And again, there's likely to be a pharmaceutical intervention that's going to come in. So that's the conventional model. The other thing is, just to say at the top, it's prevalence-based. So when we come up with plans, we have to look at 65 to 70 million populations. And if it's not affordable, it doesn't come into the plan. So NICE guidelines are based on how much you can afford, not necessarily precision medicine or up-to-date evidence. So this is something we need to bear in mind. So what are the outcomes of the conventional model? Well, first of all, we've done pretty well in terms of improvements in acute trauma, so operations, injuries, we're doing really well. Acute illness, sepsis, managed fantastically, and eradicated a lot of communicable diseases. We've also added years to life. There's no doubt that that's happened. We've reduced obstetric fatalities. There's some good work done through the conventional system. However, that doesn't constitute a huge amount of the resources. A lot of the resources are going into what we call the chronic model. So chronic diseases, chest-related problems, heart-related problems, diabetic-related problems are increasing. We've not really managed them very well. There's increase in mental health. We're seeing more suicide, younger suicide, anxiety, isolation, loneliness. Autoimmunity, I don't know what your experience is, but we're seeing a lot more autoimmunity in younger populations. One might argue we're better at diagnosing it, but actually I do believe it's on the increase. Polypharmacy-related disorders. You know, a third of hospital admissions are due to being on lots of drugs. I look after a college hospital, and a lot of the falls and the fractures are linked to patients waking up in the early hours of the morning and falling just because we've overtreated. And it's not unusual for these patients to be on 20 or 30 drugs. The one thing we do is stop half of them, rehabilitate, and they get better. And of course, cognitive decline. We're seeing a lot of people entering the field of dementia, Alzheimer's, and so we've not quite sort of bottomed that out through the conventional system, and it's escalating. What's it doing to the healthcare economy? Well, clearly there's increasing costs, but one of the other things that's happened over the last few years is the healthcare budgets are now moving into social care. So when the bucket of healthcare's come to the top, and usually that can happen by the age of 70 or 80 in most individuals, the medical model doesn't come into play anymore. It moves into social care, so nursing homes, care homes, community hospitals. So our way of dealing with those additional years is to make it a social problem. And it's very sad because when you talk to these patients, one of the things we look at is respect forms, patients' wishes if something serious went wrong. And 95% of them say we don't want to be resuscitated. So, you know, we've got to ask ourselves, what have we achieved there? With all these diseases, there's a lot more silo working in medicine. So you have specialists and subspecialists, and even in the community now, you've got multiple people looking after a patient. Now, it may look good on paper, but the reality is this silo working means that no one quite knows what's going on, and patients often sink in the middle. There's increased prescribing and increased diagnostic testing. There's at least 26,000 FDA-approved drugs now, and that's going to increase. We're able to get tests much more quicker, and what I've noticed in A&E now is the default is do the test first and then see the patient afterwards. So it's all kind of going into a different direction, and essentially most modern healthcare economies are struggling. What's happening to our profession? So having trained for, or been a trainer for 25 years, certainly the last decade, I've seen increasing general anxiety disorder amongst young GP registrars, a lot of them leaving medicine altogether, most of them not doing full-time frontline work because it's too stressful. And the reason it's stressful is because they're not able to use their intuition. They've been given loads of pathways that have been dictated, and of course patients don't come in pathways, they come as whole. And it's very difficult if you're trying to fix someone in an 8 or 10 minute consultation, and the computer tells you 8 or 10 pathways to apply. So we're seeing morale drop and autonomy drop. And it's a shame because there's a lot of training. These are good brains who are just not allowed to practice as they thought they might. So let's look at longevity in the same way. So effectively, where we have symptoms, we don't look upon things like symptoms. We look upon them as signals. These are your body protesting at you, saying things, headache, bloating, abdominal pain. All of these things are simple signals of something else going in. And once we look at signals, we look at root cause analysis. Now, that's quite a big term, and if you ask 10 people what is root cause analysis, you'll get 10 variations. And we'll talk a little bit about what that truly means in the longevity world. I mean, I saw a patient a few months ago, and she had problems with complex insomnia over the few years. And you can see in the waiting room, she's quite agitated, etc. And she came into my room, and she literally just said, "Doctor, I know what you're going to say to me. You're going to say to me that my gut's responsible for my sleep, my hormones are responsible for my sleep, and the fact that my brain's not working is responsible for my sleep. But I can tell you, I know the root cause. The root cause is my husband." And we need to get... Yeah. And all we need to do is we need to get rid of him, and I'll sleep. Which was interesting, because the word "we" did concern me a little bit in that consultation. Anyway, she's sleeping well now, and I have to say, I was sleeping less well for a few days after that consultation. But we'll talk a little bit in cellular medicine what root cause analysis is. So now the idea here is to understand what's going on externally and manifesting internally. So I think we have a duty of care to increase awareness. You know, I was speaking to somebody who'd been to Davos and met Deepak Chopra, and they mentioned that the one thing he said, it's all about inner awareness. And I think that's it. We've got a co-pilot within us, and we just need to have the confidence to listen. And I think as clinicians, that's our role. It's not to dictate from the top, not to prescribe, but actually make people aware of the link, which is so strong. And then, of course, recovery. Now, recovery is a journey. It's not a point in time. It's an escalating process. And I think this is the thing. You get better to a certain level, and then there's a better level and a better level. And, you know, Peter Attia talks about medicine 3.0. I don't think it goes far enough. We should be talking about medicine ad infinitum. That means just constantly looking for a better version of ourselves. You know, we've been told we have enough stem cells to last 2,000 years. So logically, why are we expiring so early? It's because the systems are broken down. So I think there is a much better version in all of us that we just need to sort of make people aware and listen. So longevity, it's unlike prevalence-based medicine, it's individual-based medicine. If we did cortisol testing in this room today, we'd have 100 variations. 50 of them would be just a response to catching a train or coming in. 50 of them would be significant for other reasons. We're so different, and I think we've got to be mindful about testing, because testing without context is dangerous. And you know, I think we spend more time increasing awareness of what is the body's response versus a reaction. Now, longevity is based in science. Everybody thinks it's not, but it's based on cellular medicine, and it's based on a very simple process saying your DNA is what dictates what your cells look like, and the environment around the DNA is how that expresses the phenotype. So logic says if you get that part of the journey right, the DNA to the cell, then surely the tissues and organs will look after themselves. So our work the last decade has been analyzing that and trying to bring it to the clinics rather than in the labs. There's about 300,000 papers written on the subject, but you know, it's very easy. And those 12 hallmarks of aging, you know, lots of papers out there, but they fall into basically 3 categories. 4 of them is the primary damage to your DNA. And if your DNA is your cookbook, it's damage to the book. So what's going to come out of that is not going to be great. The 4 others are the response or the reaction of the body to that damage. And the last 4 are those 2 accumulated, i.e. the expression. And if we just remember those principles, you know, it doesn't matter what patients come in with, it all applies to every single symptom. And it makes medicine a lot easier because you're looking at root cause analysis rather than trying to label and find all these diseases and diagnoses. So that's the first principle. The second principle is everything happens everywhere at the same time. Professor Plumbaum's work has been amazing, you know, and the psychology, the neurology, immunology, and endocrinology all happen simultaneously. If you have eczema at the top of your nose, you are inflamed in all your 30 trillion cells. So it's an expression, and how it expresses in individuals is different. But if we can get that message out, that you know, when we fix one thing, we should be able to fix them all, rather than send people to multiple specialisms who just do their own thing. So treating the whole and looking at the fundamentals. Now, with that, it became even simpler. Cellular medicine came to two particular points. One is feeding the cell the correct energy, and the second is protecting it. So all we have to do is feed the cell and protect it, and everything will continue in a good way. The other thing about longevity is we've not really defined it to our patient population. What does it mean? Now, we know that in the conventional world we're living longer, but actually no, we're existing longer. Those last 10 or 15 years of life are not actually living. Our definition of living is basically being independent, purposeful, and the pursuit of fulfillment. You need all three. I mean, animals can be independent and purposeful, but humans have the capability of pursuing fulfillment. And this is about a better tomorrow. The other term is hope, effectively. So if any of those are lacking, we are suboptimal. So we have to define what living is. Otherwise, we'll confuse it with existing. I hear so many patients saying, I don't want to live to 90. Well, what they're doing is they're comparing themselves to the conventional model of existing. And what we've got to say is, no, those are the three things we want you to continue to have. Professor Vladimir Kavsin, the late Professor Vladimir Kavsin, did a lot of work with peptides. And I think looking at longevity with bioregulated peptides, the research shows that we should be able to live to 123. Now, we don't. And that's living, by the way, by those three definitions, not existing. So we're all suboptimal. Everyone in this room is, by definition, suboptimal. Probably 50 to 60% of our capability based on that diagnosis. But we think we're okay because we haven't discovered the better version of ourselves. We can only compare ourselves to our neighbors, our parents, or what we were like yesterday. But we shouldn't accept that, and we should be digging deeper to find optimization. And essentially, that's cellular optimization. So that's the better bit. So living longer better is the aspiration for our patients. So what does it do for the healthcare economy? Well, if we increase awareness, then patients don't need to go to doctors. They'll find solutions from within. They will gain control, and there'll be increased personal accountability and care. And that's how it used to be hundreds of years ago anyway. We're not inventing something different, but we've been taught to delegate our responsibilities outwards, and then we feel helpless. But then we also have these experts giving us drugs, and we think that's the solution. But it is not. I mean, and certainly longevity is challenging that. The medical community. I have to say, I would have probably looked at retiring if I hadn't moved into longevity, because the pathways are getting more complicated, there's less autonomy, all of those reasons. And we're seeing a lot of our doctors leave the profession early as well as not even enter it. But longevity has brought job satisfaction, and I think this is really important. If you're going to give to people, you've got to be joyful yourself, and I think this is super important. And patients pick up on it. They have enough emotional intelligence to know when you're freaking out and you're not. And the other thing is this concept of hope. We're very good at, we're fearful, defensive even, and we'll give statistics of why things might not work. Well, that penetrates into the limbic system, and it does influence them getting better. We should be brave enough to tell people that it's going to work, and they've just got to persevere. And I think you'll see a difference in how people behave and comply with that sort of thing. And that's how doctors used to work. Better learning. Now, the data and the research in clinical medicine is so outdated. We're still following protocols from 30, 40 years ago. And why? Because the machinery is too tired to change. Longevity is about what's gone in the last 3 months, 6 months. It's changing every time. And actually, your patients are the ones who are going to make you read up things, because you'll look more and more. And in fact, a lot of our patients are experts in the subjects. They know more than most of the doctors sometimes. So better learning, increased enthusiasm. It's great to go into this field, look at humans as one, and try and fix everything. It's much more rewarding. And greater integration with the healing community. Medicine has been very directed, but there's so much good work, and you're going to hear about it this afternoon, going on in the healing community, who I think are far more in tune with human connection than we as doctors are. So, why are we failing? I guess the main thing, and why are we failing in longevity as well as convention, I think the key thing here is to look at the trends of humans. I mean, this was probably 1980s, and this is where we are now. That's just been, 40, 50 years? This has been thousands of years, thousands and thousands of years going all the way back here. And I think our cells are still here, by the way. They're still sitting in this guy. because we adapt to our environment. But when the environment moves at such pace, our cells can't do that. So our bodies are still behaving like they're on the savannah or in the deserts. They're built for scarcity. They're built to be in what I call hormetic stress, not chronic stress. So effectively, the starting point is, the minute you're born, you are living in an environment of toxicity. And I think that is the starting point, which is why we're all suboptimal. And this journey is getting quicker and quicker with AI. And the worry is the cells are being left behind. So that's why I feel we're going to see more problems in the future if we don't look at it differently. The other thing is invisible intruders. Any metropole or abundant society has a number of things. This room has probably got 200 toxins in it as we're breathing it in or it's being absorbed. And these invisible intruders are air pollution, water pollution, soil contamination with hormones, electromagnetic fields, chemical exposures, radiation. These are all things that are affecting us, and we do a lot of testing to show what's in people, and literally 100% of our patients have heavy metal toxins in them. And a lot of these toxins have 30-year half-lives. It takes 30 years for 50% to leave you. And yet, we all aspire to live in a metropole, the excitement, etc., but our cells are still on the savannah. That's where they're best. So these invisible intruders are causing issues. And there's also invisible inflammation. So my view is every disease is inflammation. We should be changing narratives. We should be asking each other, how inflamed are we? Where's our inflammation showing today? Rather than diseases and disorders. But a lot of this inflammation is not going to manifest till much later. So our bodies are literally running a marathon internally, fighting an inflammatory response, depleting hormones as a source of energy, looking at immune systems as a source of energy, and the cells are getting tired, and the immune systems are failing, and we're not able to detoxify or use our rest mechanisms like our vagus nerves. So all of this stuff is happening, and we just put it down to life. In fact, it's our cells in distress, not in disease, but in distress. So again, an awareness of this is what we need. We can't go back to the savannas, but we can do something to try and mitigate these primary problems before they become diseases 20, 30 years later. And remember, this is not just about existing, it's about living. When you're optimized, you think better, you have bandwidth, you're perceptive, you have emotional intelligence, you're calm. So this narrative extends beyond health. It extends in a totally different way of living. So we're going to look at some of the solutions, some of the offerings in the next few hours. But I have to say, again, it's only 1% of the possibilities. And I think there is a danger that we will complicate this field because people will just snatch and grab whatever's in front of them. So at the end of the day, I'm just going to talk a little bit about how we've created a pathway. And it doesn't matter how many procedures are under that pathway. If you strategically follow this pathway, you'll get a result. And depending on where you are in the world, you can choose something. Longevity is global. It'll look different, but it is global if we could look at some sort of pathway mechanism. Retrospective reflection. I think the last 10 years have shown me that as a medical profession, we owe an apology to our holistic colleagues. I do remember being in busy surgeries when patients come in and they bring a list of things, of testing they've had for their gut and their heavy metal, and saying, what do you think about all of this, doctor? And my solution was, don't worry about it, just take the pill and you'll be okay. Because we didn't have the knowledge, we were ignorant, probably egotistical, and actually, this was the work we should have been doing. So the systems did not allow these holistic therapists to come in. I think we need to all offer them an apology because now the world is looking at all these elements that existed in nature for millions of years. So I think that's something that I've learned through this journey. So what I'd like to now do is pass on to our next speaker, and I think Phil's going to introduce them, but I'm hoping you're all going to have a good day today.
Thank you, Ash. I think it's a great scene setter to get us started. And I think that questions are already coming through on the app, which is wonderful. So please do keep them coming. No question time for Ash, because obviously we're trying to keep things on track. But one of the questions was, are the slides going to be available? And we'll make sure that we ask that question and ensure that they are available for you when we have permission from the presenters. So now we're going to be talking about adaptogenic power of mushrooms. And our presenter is Catalina Fernández de Ana Portela, who I had the pleasure of sitting next to at dinner last night. So we talked all things from mushrooms to head transplants. And we're not going to be doing head transplants today, just so you know. And great to see you. That's it. All right. I think you're all good to go. Thank you.
Okay. Good morning, and thank you all for being here. Thank you for the invitation to be here talking to you all in such a beautiful environment. So I'm Catalina Fernández de Ana. I'm a biologist. I did my thesis work on mycotherapy, the use of mushrooms in oncology, so coadjuvancy. So I did it in the world of the oncology. You can imagine how it was to present a thesis in medicine with the use of mushrooms. So the rejection at first, it was incredible. But then with time, with evidence, well, it came out with a cum laude, so it had to be accepted. And that was one of my main projects in life, to bring the knowledge and the capacity of the mushrooms to the high academia and to demonstrate, in order to be able to say that question that every doctor always asked of, is there evidence? And then when you put the evidence out there and you show the amount of evidence that there is worldwide, because this is a work that has been done throughout many years, hundreds of years, I would say. It started with the traditional Chinese medicine, and that now, with science, we're backing up, just because we need to talk in same terms as pharmaceutical compounds. So what we're going to be seeing today is how medicinal mushrooms are going to optimize health. We're going to go through defining longevity, which I think that Dr. Kapoor has made an incredible work. Medicinal mushrooms, the key strains, the holistic effect. I think it's very important, the gut-brain, immune, emotional, performance and function, and what we're doing at EFAS. So defining longevity. I think we were having yesterday so many beautiful talks, and we talked about so many things. And one of the things that came up today is that Galicia, where I come from, in Spain, is one of the newest blue zones, which is not, still is not published. But we have more people living more than 100 years old with the complete autonomy, with the complete sense of life than any other part of the world. And why is this? Well, it's mainly because the Atlantic diet, because there's a sense of purpose of community, taking care older, elderly people of youngsters, and being part of that community, and living in a very, very extreme clean environment, which is the coast of Galicia in Spain, where the winds of the Atlantic are hitting for the first time, and our community still is very green, very clean, our waters are clean, and that helps us to be very longevos, which is a word we were discussing. So longevity, when you're applying it to someone, you are a longevo person. So we do have longevos already, which are more than 100 years old. And so as we were saying, what we are looking at is the overall well-being, that we really want to decrease the disease burden and maximize the intrinsic capacity and function. And years of good health, at the end, this is a discussion, I constantly see it, even on myself, my friends, my circle, where you see fathers, parents of others, that they're just existing, as it was well said. And that is not what we want. That is not what I want for myself. That is not what I want for my parents, for my family. So we need to look at other way of living better. But this is not being done when you are 80. that has to start. So the thing here now is we need to change the medicine that it's acting for the medicine of prevention. We need to start showing the patients how to live better, because by empowering them, by giving them the knowledge, as Dr. Kapoor was saying. And then, obviously, when there is an acute phase, that is perfect. And there is where the big drugs are lifesavers, and there is where we really need to start working. So what are we going to see with medicinal mushrooms? We're going to help reverse aging. They are very useful in longevity and improving the quality of life. They're very anti-inflammatory, and it has many, many roots, as we're going to see. Very powerful antioxidants. They're going to reduce stress, and they're going to be very beneficial also for sleep. We're going to see, and they are going to be enriching our microbiota with prebiotic qualities and mood boosting. And why is this? Why is that we are going to be seeing all of these effects, which this in medicine, it's always very fascinating to see how one compound can be being inhibiting or increasing at the same time with the same dose. And this is because they are adaptogens, meaning that they can adapt the response of the body. They can be biological response modifiers. They can really adapt the response of the body to the situation you're living at that very moment specifically. And the very beautiful thing as well is that mushrooms are working in the cell. They're working at a cytotoxic level. They're working in the membranes. They're talking in the transports. They're talking in the signaling. They're working in all fronts. So we're working at cell by cell in the mitochondria. We're optimizing every cell. When you're working at every cell, then you're working at an organ level, then you're working at the whole system at the same time. So that's why so many times you're going to be treating a patient with one mushroom specifically for one condition, and suddenly they're telling you, you know what, my levels of cortisol are coming down, or my levels of triglycerides are coming down, or because the body is not about one purpose, one drug, one system. It's about a whole. It's about a whole. So you're treating the cells, you're treating the whole. So what is making the mushrooms the good candidate, as we were saying, for longevity? Well, these are all the actions we're going to be seeing. We're going to be an immunomodulation, which is very interesting because we're seeing them that what they do is to help in the cascade of the immune system. So we're seeing an orchestration of the immune system that's going to be give us a very mild response, and we're not going to be creating an autoimmune system, autoimmunity, as we're seeing in many, many patients. We're going to see the anti-inflammatory effect, the antioxidant effect, as I was saying, an adaptogenic. We're going to see the promote of the regeneration nervous tissue, and to contain or promote the production of neurotransmitters, such as GABA, regulating the microbiome that we know now that it's so difficult, so different, so we are a whole ecosystem walking. So we know the microbiome is going to be different in every single part of our tissues, in every body, in every organ related now. We're working right now in a clinical trial with breast cancer where we see that the microbiota of the breast is different than the one from the arm, or different from your tummy. So if the microbiota changes at that level, we need to be feeding our microbiota in order to have that we are in an eubiosis in all of our body. And this is extremely important. So when we're going to be with the key fungal nutrients for longevity, one of the most of importance that we are seeing now on dementia and degeneration is ergotionine. That's a key one that we are studying very much right now. We have the terpenoids that every time they're very small molecules, but they are so interesting. And we are seeing the power on the inflammation. We're seeing GABA, which is also so interesting. We're going to be seeing the key actions in reishi mushroom. For example, reishi is the most known mushroom in the world. Now, for us, it's like we are newcomers to this to say. I've been studying mushrooms for 25 years. I was born in a family with mushroom. My father is a phytopathologist, a doctor of plants, and he would be studying the mushrooms always. So I was born into this family, happily. And luckily, and so to me, it's something very normal to see the mushrooms and their capabilities. And that's where we started studying, and we've been for 25 years now studying the capabilities of the mushrooms. And reishi is one of the most known, but think that there's a power out there. When you go to China, you can be eating at a restaurant, and the one I counted, the most species, were 46 species that you could be taking in one go, in one day. Well, here we are starting. So this is the new world that is coming, the new world of molecules that we will be seeing. It's going to be from the deep sea and then the fungal world. Why don't we know this until now? Well, because mushrooms molecules are difficult to study. But even though this seems something new to the Western world, but the truth is that almost 40% of our big drugs today come from mushrooms. And I'm talking about Taxol, the big molecule in oncology. I'm talking about, obviously, penicillin. That was the game changer in the history. That's the big one that made us really survive in big numbers. I'm talking about cyclosporins. I'm talking about so many drugs that come from the mushrooms, but we don't realize about that. And so these are the compounds. Now, to me, the difference between an extract and a drug, that it's a monomolecule, that is going to be going to a pathway that's going to go direct to a cell, is that we have a cohort of so many other molecules that we don't even know. We're talking here about 400 molecules, 500 molecules. But in our late studies, we have seen that we can even get to 1,000 peaks of different mushroom molecules that we don't even know their names. So it's a whole incredible science. We are opening a new book of this story here of history by defining all of these small molecules to understand how ones are working with the others. And this is what is helping us when we're working with a very powerful extract to be avoiding secondary effects. So we have powerful impact without having the secondary effects. And to me, this comes to the big, great oath, Hippocratic oath, where the first thing is do no harm, non nocere. This was the big oath that we have to all have in mind, that the first thing is that always do well and no harm to your patient. So this is my first and very important pillar, where we will always get to the point where we will be concentrated molecules. We will be looking to a big active action, but always with no harm related. This to me is really important. And this is what mushrooms are capable to do. So as I was saying, we can see all of these effects on reishi, and we are going to see with these terpenoid compounds, ganoderic acid, lucidumol, lucidone, alpha-linolenic, germanium. So mushroom, it's known as the mushroom of the eternal youth and immortality. It was given to all the emperors, and the reishi was thought to be, when you found a reishi in China, you had to leave it for the emperors with death penalty, because it was only for them to be lucid and very, very old with this knowledge. Then it was open to the whole community. But one of the big emperors was already a farmer, the one who was farming, and he was teaching the community how to farm, and he already was giving a monograph about how the reishi should be used in the 1500s before Christ. So we have a lot of knowledge. We know how they work with the antioxidant mechanisms, the antioxidant enzymes, the protection of mitochondria in macrophages. This is very important. Then we have lion's mane, the Erythrum marinaceus. It's a big mushroom that now it's coming up. It's so famous right now. It's very funny for me to see this momentum on the trend. So to see how we've been there with mushrooms for 25 years, and suddenly one mushroom becomes famous, and because everybody's talking about this mushroom. So you all have heard about lion's mane, and this is beautiful to me. I was waiting for this to happen because it was so frustrating to be talking for thousands of people, and everybody, like, what? Erythrum, and now everybody knows about it. So what is the Erythrum doing? It's a magnificent mushroom that is going to work on two big main systems, which is digestive system and the brain, so nervous system. And if you look at the picture, what is in the traditional Chinese medicine is that the remedy has to resemble the organ that is going to cure. And when we see in cultivation lion's mane, that's called also monkey head, it really resembles a brain in the first stages, and when it develops then, you're going to see that it really looks like the guts, the lining of the gut. And this is absolutely beautiful because, you can get all of this knowledge that is coming from the world, and it really makes a lot of sense. So why is it working? When you think about it, why is it working on the gut-brain axis? And it's because the cells of the gut and the cells of the brain have been developed from the same stem cells at the same moment in the moment of the zygotes. So they respond to the same stimuli. And that's why the lion's mane can act over those two systems so incredibly. It's going to be a fantastic prebiotic. What we see is that the probiotics, so the microbia, they're going to be looking for the mushrooms extract. They live with them, and they're really looking to them because it's the best prebiotic fiber that we can find. And this, we're seeing it in the clinical trials, where we're looking for to establish direct biomarkers with the microbiota directly to the respondness in cancer about how people are going to respond with the biomarkers of the microbiota. And this is incredible. We're doing this in the latest clinical trial that we're doing in Spain. So, and the nice thing is that it's going to promote the nerve growth factor, and also the promotion of the synthesis of myelin. It's one of the only natural substances that can go through the blood barrier and the brain-blood barrier and can really go to induce this synthesis of myelin. So we're going to see in a very little time how it's promoting the growth of the, in fact, we can see that in 17 hours. If you put the cells in the lab, you can see in 17 hours that it's promoting the growth of the nerve cells. If you do it with the gut lining, you're going to see that the differentiation of the cells, it occurs in 17 hours instead of 57. So imagine against a Helicobacter pylori, for example. You're having a gut that has been damaged by a Helicobacter, and suddenly you can do that, you can manage that the rejuvenation and the renewal of those cells is happening every 17 hours instead of 57. You're going to have a lining that it's way faster renewing, and that is going to take and peel off physically a Helicobacter, so we're going to get rid of it much faster than if we have the normal system. Cordyceps, another of the big ones, and Dr. Kapoor loves cordyceps. This is a huge mushroom for humanity. How was this? Well, we're talking about, mainly when we talk about cordyceps, we're facing here two things. ATP, so we're increasing ATP levels up to 30%. So imagine if you have the molecule of power, and you can increase that in 30%, what this can do on a body. And we are also increasing up to 40% oxygenation. It's if you try it, and then you go to the pool, in the pool you can feel that you really are floating much more. It's like you had a power oxygenation on your back and you're feeling this flotation. So we're going to see here that we're protecting our kidneys, we're protecting the architecture of our kidneys with cordyceps. If we see proteinuria, we can see it decreasing very rapidly. We are going to be seeing the energy, the muscle production, how we are increasing that mass of muscle, and that will be, obviously, when we're talking about longevity, we want to be no more existing, but we want to be fit. We want to be energetic. We want to be strong. And this is what cordyceps is doing. So, as I was saying, I have to start running a little bit because I just have 10 minutes left. So, we know that it's a tonic in situations of fatigue and asthenia, incredible. And this has to be, we were talking about microdosing. It doesn't work, microdosing in cordyceps, okay? We're talking here, there's a dose dependency. So we need really a good dose of cordyceps extract to see all of these effects. It's going to be an energizer in athletes. We have many athletes that are working already with cordyceps, and they are beating constantly their marks. We see is that whenever they are going to their maximum levels, cordyceps gives them this 20-30% increase on top of it that allows them to be the first one. And I cannot say names, but I can say that we have great people in Spain playing tennis that are using our cordyceps, as well as great football players in Spain that are using these products. And because they test for, they're not giving. Well, I don't get another word for the testing that they do them for drugs. So they can use it freely. And so we have even a clinic here in England that uses very much for athletes and with incredible results, measuring absolutely all the variables. So we're looking for the holistic effect. We're looking for the gut, brain, immune, and emotional system. Why? Because we're looking for longevity. We want to be very old, very wise, and live very happily. We don't want to be sitting in a chair and just not knowing who we are. We really want to have all of this in a go. And how do we do this? Well, with mycotherapy, we're going to be the main therapeutical uses where we're going to see that it works incredibly well. I have to say that in this 25 years, I have seen it work in almost everything, but these are the main areas where we can work, which is gastrointestinal, immunology, oncology. Obviously, oncology and immunology is a one, because as you all know now, we are more and more discovering that I always call it the almost perfect machine, so the quasi-perfecta machine that is our immune system. And for so many years, oncology wanted to just let it down and try to come with the chemotherapy drugs and just attack the tumor. And suddenly now, thank God, we have discovered that it's in us. It's our immunology that is going to help us to go through the way, as well as the big drugs that are going to help alongside. But you cannot kill our own system. So what we're seeing, that it's not only in oncology, it's not only about immunology, but it's also your gastrointestinal system has to be working perfectly. We're going to be seeing also how it's the musculoskeletal system. We're going to see there big also results. And mental, emotional health. This is incredible, the results we see here. So if we're talking about the immune effect, what we're going to see is that they are excellent adaptogens. They are going to work with this microenvironment, because what are the mushrooms? What are they doing in the environment? We work in Alifas, what we're working is the One Health concept. So we're working in an environmental concept. So we use mushrooms for micro-restoration of soils, of plants, with mycorrhizas and so on. We work with pets, with the pets and the farm industry to not give all the drugs to also the cattle and so. And then we work with humans. And what we are seeing here is the microenvironment, but it works, we're all an ecosystem. So the environment works for the world, the soil, It works for us, for our microenvironment. They're big chelators. So they will be either chelating the soils or chelating our cells. And this is very important. And that's why also we need to understand the mushrooms we are working with, because this is the first and main virtue of the mushrooms. You need to understand that those mushrooms are healthy in order to bring them into your body for make them healthy as well. How can mushrooms support then our gut health? Well, we're going to see the beneficial bacteria, we're going to see reducing inflammation, enrich the microbiota diversity. So one little thing here that is so important, that is very exciting. In one of our last clinical trials, what we discovered is that when we gave the mycodigest, that is one of our preparations, we could see that one bacteria that is a filamentous bacteria that it only appears in the moment of when we are born, and then it starts all the cascade of the evolution of the diversity of the microbiota, and then disappears forever. It came again back. So our patients in the clinical test were showing this new bacteria that was appearing there and starting again the evolution of the whole microbiota. It was a reset. So we baptized the idea as the reset of the microbiota, meaning that it starts the whole cascade again of your new microbiota being born from scratch and starting the new development. And this is exactly what we can see with the mushrooms. So we know about the axis of the gut-brain. So what we were talking about, the gut microbiome, the intestinal microbiota, how a disturbed microbiome is going to be my impact in the central nervous system. We all know about this, and how this dysbiosis is a very common factor in the clinical depression. And we see how this is improving. Why is this not going? Okay, this is not moving. Oh, no. So we can see also the brain function with the mood and longevity, and where we will be seeing the optimal functioning with clarity, focus, concentration. And this is what we saw exactly in this, we did this scientific trial, where we were seeing how how the patients were having, with the intake of this lion's mane, they were having improvements in attention, in memory, concentration, processing speed, and what was very, very important is visual spatial skills. They could feel, which I had never realized, that when you start with a neurodegeneration, one of the first things that starts is that you lose the visual spatial skills. So you're lost, because you don't remember how you came in, where is the exit, and this is horrible, because suddenly you're lost. And this is something they recovered while they were taking the products, which I found incredibly interesting. Then the NUS study, this is something absolutely incredible that we saw that in Singapore, taking 300 grams of mushroom daily, there was a reduced risk of a cognitive impairment by 57%. So this is absolutely incredible, where we can see that the role of medicinal mushrooms in delaying neurodegeneration. But as we say, it's not something that we're going to take a pill when we're 80. It's something that we need to start doing when we are young. So we did a microarray study with a microarray product with 2 capsules, and what we saw, the results, is that 50% reported absence of anxiety, 38% represented mild anxiety, reduction in pre-study levels, and only 12% continued with severe anxiety. And with the sleep, we had an increase by more than 2 hours. For people that have, you can't even imagine, or you do obviously, but how many people in society sleep 4 hours daily? And that is incompatible with life. So to increase 2 hours over 4-hour period of sleep, it's just impressive. And this is what Reisha did with any type, no type of secondary effects, which again, it's very important. Performance and function, we know that the cordyceps is very important. So for instant energy, remarkable rejuvenation, and cognitive and sexual revitalization, just one thing, because the time went out. One thing that I always get back from men when they try cordyceps is, and you will know how to interpret this, is I wake up as when I was 20. So this is the anti-fatigue mushroom for the musculoskeletal system and energizer and muscle enhancer. So the only thing, just the last, is we make this work at IFAS. What do? We are very careful with science. For me, this is absolutely important that we know that not every mushroom is the same, not because of the mushroom, but the excipients. What we do is we work with cytochrome P450. We have looked into it. We are very seriously we're working and going through ethical committees. We're working with chemotherapies, with big drugs. So we need to test everything. And this is what IFAS does incredibly well. If you need more information and you want to know more about mushrooms, you can join the professional area at IFAS, and you will have there the support. Thank you very much.
Well, I'm sure you'll agree, a truly fascinating subject, and I'm sure Catalina won't be able to get a coffee in at the break because she'll be overrun with questions. Okay, so as you can tell, we're leaning into some really great subject matter, and the next one is very important to everybody, right? So we all know about gut health. We've heard about it already in the presentations, but gut health and longevity is very fundamental, and we've got Dr. Elizabeth Almas coming to speak now. So Elizabeth, are you able to come and join us? Great to see you. Thanks for coming. Great. Are you going to be just on there? Okay, perfect. Yeah, great.
Brilliant. Let's go. So Ash told me to be inspiring and then gave me the topic of microbes and the gut. So here we go. All right, so I'm going to be talking about gut health, immunity, and the liver, and essentially the really important role of the gut in longevity, but also just for well-being, addressing root cause, issues with root cause medicine through the gut, essentially. So we're going to be talking a few myths surrounding gut health and debunking them, microbiome and the immunity, and understanding kind of the connection, ultimately, how we can make it better. And touching then a little bit on how, if it all goes horribly wrong, how we can end up with autoimmune diseases, but it's reversible. And then we'll hone in on the liver specifically, because it's so important, the connection essentially between the liver and the gut, and just understand its role, essentially, and how our body works and why it matters. All right, so believe it or not, we are basically more microbes than anything else. And it was really only in 2007 when we sort of finished doing the Human Genome Project that we sort of realized that we've almost got more questions now than we did when we started. And that's when they started turning their attention to the gut and the microbiome and trying to find a few more answers. It's basically vital, and hence why we're kind of talking about it today. And if you sort the gut, a lot of downstream things go well. So, myth one, gut health only affects digestion. Wrong. Touched on by Catalina, but the gut-brain axis is absolutely key. It's basically a highway between the two. And as you said, we sort of start from one cell and it proliferates, and that's what makes our brain and that's what makes our gut. And believe it or not, in studies of mice, they severed the vagus nerve, the sort of runway between the two, and the inflammation in the brain just fell away. And stuff like Parkinson's disease and dementia and Alzheimer's and things we battle with in a daily practice disappeared. And then think about the gut-lung axis. So again, it's the gut that's talking to the lungs, and it's saying, here are some anti-inflammatory cells. So things like COPD and asthma, which take up so much of our practice time, you feel so much better, and the inflammation dies away. Gut-liver axis, I'll move on from that because we're going to talk about that at the end. Gut-skin, how many people have had dry skin or psoriasis and eczema? Ultimately, we know that there are certain microbes in our gut that proliferate your chance of that happening. Think about Clostridium, think about Staph aureus. If that's given the chance to grow inside your gut, your skin is ultimately the window for what's going on. So if you think something's wrong with your skin, think about why, and the answer is usually in your gut. Gut muscle is really interesting. We all go to the gym and we build muscle, and muscle is essentially fundamental to longevity and our health when we get older. Ultimately, for muscle to repair, which is what we're hoping for when we go to the gym and tear it, we want it to repair so it gets bigger, you've got to have a good gut, because the cells in the gut calm the inflammation and address the tearing that happens in the muscle. So that's super cool. And then the last one, gut immunity, we'll touch on that through the presentation. Myth 2, a leaky gut does not exist. Well, I'll tell you it does. Potentially the term has become a little bit thrown around. However, this idea of leaky gut used to focus largely just on tight junctions. The idea that it's a wall, it's a tube, and it needs to be tight, and you're not supposed to have things coming in and out. That's true. And ultimately, through stress, infections, toxins, just generally being inflamed, this wall starts to ultimately degrade, and it opens, and things that shouldn't exit start to exit. And that's when we have a problem. Now, tight junctions, absolutely super important. We want them to be tight. Our knowledge has sort of developed. It's always changing. And now we know that it's not just about tight junctions. It's about stem cells. It's about mucus layer repair and epithelial regeneration. In our body, in 1 to 2 hours, the entire epithelial lining can restore and repair itself, which is great because it means that whatever damage we did yesterday, we can fix today. Stem cells, again, they need to proliferate, they need to differentiate, and certain pathogens in our gut, which we can test for, they stop that process. And over time, you can see these things accumulate, and we end up with some of the downstream problems that we see as sort of symptoms, I guess, in daily clinics, ultimately. Okay, probiotics, they're absolutely brilliant. Are they the one-hit wonder to restore your gut? Not really. And we know more now, so we know that we need to go through a process. We need to remove, ultimately, the bad stuff. Think of a garden. There's no point planting new seeds and beautiful flowers if it's covered in weeds. So we need to remove and clean out, and then we go on to repair and rebalance. Think about the 4 Ps. They'll come up a few times in this presentation, but it's basically your food, and your food becomes polyphenol-rich foods, prebiotics, probiotics, postbiotics. They're so important for feeding the content of your gut. Dysbiosis basically means you don't have enough of these 4 Ps, and we need to change that. Again, the mitochondria are absolutely key, and mitochondrial fatigue is also a term that people talk about, but what does it mean? It's basically cellular energy, and the gut, second to the brain, is hugely dependent on energy. It needs it for the stem cells, it needs it for the epithelial lining and the mucus repairs. So that's another cornerstone we have to address when we're thinking about how do we fix this gut. So, in short, what makes a good gut? Yes, absolutely, strong, tight junctions. Loads of butyrate-producing bacteria. Butyrates are short-chain fatty acids. They come from our food, our fibers that we eat. We need a robust mucin layer. It's protective. It keeps us a watertight tube, ultimately. We need a balance. We need some good. We need no bad, ideally, but we don't need too much good. So we need a balance in the microbes that are actually there. And then we need to keep these stem cells active. We've got loads of them. We die with too many of them, so we need to activate them. Okay, I just want to touch on short-chain fatty acids because they essentially are the cornerstone of what becomes a very healthy gut. And as I said, they're produced by bacterial fermentation of fiber. And they support the beneficial bacteria that we're ultimately trying to improve, enhance, and they give us a lot of downstream metabolites that are super important. So we think about the burden of mental health, and how we're generally going in the wrong direction. And serotonin, for example, in the peripheries, 80% of serotonin is actually formed in the gut. And so we need to support the gut. If we're thinking about mental health, yes, absolutely, we can use antidepressants, but we've got to do the gut too, because otherwise we don't have this peripheral production. So short-chain fatty acids come from our food. We can use food to get better, but there's a process to it, but they're really important, so just keep them in mind. And certain things that we do all day, every day, use antibiotics, stress, fast food, sugar, it kind of depletes our stores of this. I just want to touch on branched-chain fatty acids because there's such a big push for protein these days, and protein is talked about everywhere. And absolutely, protein is totally fundamental, and I'm all for it. However, we need to remember that our bodies are primed to use glucose and the sort of byproducts of carbohydrate metabolism as their primary source of energy. And as I said, the gut is hugely energy-rich. And so what happens if we overdo the proteins is that we get these products of protein fermentation, known as branched-chain fatty acids. Basically, we just want more short-chain fatty acids than branched-chain fatty acids. So just remember, protein is great, but don't forget your vegetables. Okay, so what do? Again, we just want to diversify our diet. Go into a supermarket, find a plant food that you've never seen before. Perfect, buy it, add it in. We're aiming generally to get about 30 different things a week to optimize the way that our gut content looks and consequently all the downstream effects that the gut has. So, there's a lot of talk about fermentables like kefir, kimchi, soy, and all the fibers and the polyphenols. They all come together to create essentially what becomes a beautiful gut. Okay, gut health and immunity. Look, ultimately, the immune system, 80% of it resides in your gut. And so there's no point in taking every cough mixture over the counter and suddenly drinking a load of lemon tea if you haven't thought about what your gut looks like. So if you're sitting here and you're like, oh, I got ill 10 times last year, think about your gut. It ultimately is the place where immune tolerance is created. And when I say that, I'm sort of honing in on this idea of T regulatory cells. They're produced in the gut, and they go all over your body to reduce and calm the inflammatory response, which is important because, as we alluded to earlier, we sort of see chronic disease as sort of subset symptom of inflammation in your body. And again, the short-chain fatty acids, butyrates, propionates, are hugely important in this. And what we eat is what makes this. Over in the States, Dr. Cara Fitzgerald has been focusing on how we ultimately reverse our biological age through food. And gene modulation is a subset of that. So ultimately, we can use a whole foods diet, and it totally turns off our inflammatory cytokines, which is super cool. We vaccinate. Fantastic. I'm all for vaccinations. However, let's get the most out of the vaccines that we take. And our vaccine response is dependent on whatever's going on in your gut. If you have a good array and good diverse gut microbiome, you're going to get more from that vaccine. The same goes for immunotherapy in cancer. So we see in studies that patients who respond the best to immunotherapy treatments have a diverse gut microbiome. They even honed in on a specific microbe called Akkermansia and gave patients a high dose of Akkermansia through their treatment, and the response completely changed. So it's powerful. Ultimately, over time, the habits that we have and the lifestyles that we lead to essentially dysbiosis, so a disarray of the good bacteria versus the bad bacteria. When this happens, we fall down that stream of autoimmunity, your body attacking itself and thinking, hang on a minute, what's that? Let me kill it. And it leads to symptoms, things like rheumatoid arthritis or Hashimoto's commonly. And what we know is that when we look at Hashimoto's patients, they have a much higher amount of dysbiotic, opportunistic bacteria than the normal population, not suffering with the same problem. There's a direct link, ultimately, between celiac disease and your predisposition to getting multiple sclerosis or MS later in life, because the proteins that escape from a dysbiotic gut enter into the bloodstream, into the systemic, And the body can't tell the difference between the structure of a gluten molecule and the structure of your nerve cells. So it's really important to, when we find or have patients with autoimmune disease, to take it right back to the beginning and think, okay, let's bring it back to the beginning and start again and wipe the gut out and build it back up. Zonulin is the only protein in the human body that can open and close these tight junctions. And so what we see is with autoimmune patients, they have a much higher level of zonulin, ultimately because suddenly the gut wall's gone from tight to wide open. And again, the short-chain fatty acids, butyrate in particular, are particularly low in these rheumatoid arthritis and MS patients. Again, poor diet, chronic stress, infections, the things that we ultimately struggle with without maybe even knowing are so important. And we have to rebalance and step back. And obviously, the work from HIFAS and later some of our breathing exercises will really help to realign ourselves and reduce the stress that has such a negative impact on our gut and consequently our symptoms. And HPA axis, so hypothalamic pituitary adrenal axis, it's all over the place in the modern person, ultimately. We have poor sleep. We eat when it's dark. These things are all so disruptive to what is a perfectly aligned system. So we just need to bring ourselves back and go with the flow. Like when it's light, eat. When it's dark, try not to. Stop. Okay, the liver and the gut are basically best friends. There's a highway between them, essentially. And in the gut, we, over time, with all the different habits that we have, we increase what's called lipopolysaccharide toxins. And they shoot up towards the liver and they cause problems, inflammation, fatty liver disease, maybe end product cirrhosis. And then the liver responds to the gut and says, you treat me like this, I'll send you dodgy hormones, I'll send you toxins. I won't bother making bile acids. So it's a bidirectional relationship that we have to give a little bit of love to. Now, bile acids are a fascinating topic that I'm going to talk on just at the end. But the liver ultimately is a detox powerhouse, as long as we treat it like one. And it has two phases, and I mention it because we have so many patients in our clinic who ultimately one of these phases is not working, whether it's because they don't have enough methylation capacity or they have sluggish methylation. What happens is that we're left with these reactive toxins that are not dealt with. So we need methylation, for example, to neutralize these intermediates and get rid of them. We need to push them into the gut, push them into the urine, and not let them circulate, causing more problems further down the line. So the liver is key. It does so many things. I think we underestimate it. It rejuvenates itself if it gets injured. Not many other things do that. We think about the pancreas when we think about insulin and diabetes, but actually it's the liver. The liver's equally very busy addressing glucose, creating insulin, managing insulin sensitivity, which is a huge hallmark, essentially, of aging. As soon as glucose and insulin become dysregulated, we ultimately end up, at some point, developing unwanted symptoms, chronic disease. It obviously filters our hormones, our toxins, and creates what is to be our metabolic waste. If it becomes disaligned, these processes become slow. And consequently, 5-10 years down the line or even sooner, we don't feel so good. It's busy making cholesterol, and cholesterol is so important for our hormones. But, last year, 900,000 more people started taking statins, so anti-cholesterol medications. So we're left in this tricky position where we're really sort of treating ourselves for one thing and damaging another. So that's something to keep in mind. I'm going to talk about secondary bile acids because I wouldn't say bring it to your first date and talk about it, but it is super interesting. So we'll touch on it because it's quite a new area, and we sort of underestimate, I think, how important these are. They're made from cholesterol and they're released by the gallbladder. 66,000 people last year went and took their gallbladder out. And what are they left with? A whole host of downstream problems to do with their metabolism and their gut and symptoms and how they feel. So it's a bit of an epidemic. And so basically we want to understand, what are secondary bile acids? Well, ultimately, bile is released from the gallbladder. It goes to the liver. You create what's called primary bile acids. And then that goes on, using the microbes that are in your gut to create these secondary ones. And it basically impacts motility. It supports this intestinal barrier, which is so important for the integrity of it, is the cornerstone of disease, and basically supports, again, the stem cell function and tissue repair. SIBO, IBS, these are things we see all the time. The number of people who say, oh, I've got IBS, as if, just a passing comment. We need to, for these patients, to optimize them and serve them, we have to think about secondary bile acids, not just the dysbiosis or the gut, the actual metabolites of the gut content. How do we do it? It's all within our power. It's not that difficult. Centenarians knew it. They've got a huge amount of bile acid present in their guts. It's a distinguishing factor between centenarians and some of the rest of us. And it's shown to extend lifespan in mouse models. And caloric restriction, absolutely. Fasting is so powerful, you can do it at home. You don't need someone to help you. Within reason, 12, 15 hours. Doesn't have to be 7 days or 21. But it's powerful, and it works, and we see it works. And also, optimal bile flow. What does it mean? We want to move, we want to sweat, we want to get our body moving, flowing. It helps stimulate and release the toxins that's accumulate in the liver. I touch on this because Ozempic, Wegovy, it's huge, right? Everyone loves it. And I just wanted to say that if you look after your bile acids, your GLP-1 will increase. This is all within your power. And GLP-1 makes you sexy. All right. What do we need to do? We need to think about sugar. It's a disaster. Every corner you turn, there's sugar in your face. So it is tricky. We need to support methylation. 40 to 60% of the population actually aren't particularly good at methylating, making the work of the liver incredibly hard. The solution, to a certain extent, is simple. We change the form of your vitamins to a methylated active form, reduce the burden on the body, make it accessible, and the downstream effects are huge. We obviously optimize your gut. We've understood that the metabolites of the food that you eat ultimately allow these processes to happen. It's bidirectional, it's feedback, continuous. We use the products of the sponsors here today, Ohira, HIFAS, they all have such a big role in the way that we address this. Certain key nutrients target the liver, the NAC and glutathione and bitters. It's powerful and it works. But it has to all be done together. You can't hone in on just one system and hope for it to change. We always prioritize a nutrient-dense diet, and then we support it with some supplements. And then, obviously, we'll always say limit alcohol and processed foods. And we try and protect ourselves from environmental toxins, but it's hard. So instead, we do what we can, and we optimize how we get rid of them. Again, small changes, huge impact. A lot of this can be done at home. The number of people who come in and say, oh, I don't know, I drink about 500 milliliters of water. And I'm like, wow, you can't be well. We've got to work on hydration. And you don't need to drink 10 and sit on the loo all day. You need to drink maybe 3 and add some electrolytes to make the most of what you have. It makes a really big difference into how your body functions, and by default then how you feel. And we obviously want to support the food and help in that sense as well. But again, bowel movements, it should happen every day and it should be kind of fun. The people who come in and say, oh, I don't know, 3 days maybe since the last one, and it's as if it's normal, is totally mind-blowing. And just know it doesn't have to be like that. So there's definitely answers, and addressing some of these really small things, the knock-on effect to systemic inflammation, chronic disease, autoimmune disease, food allergies, huge. They basically they go away. And just touch on a few things that you can use either in the home or as supplements to kind of support this process. If you have had your gallbladder out, take a little bit of Todka perhaps. It will really help you feel about 100 times better. So thank you very much. Pleasure.
Okay, right. So we're gonna go for coffee in just 1 minute.
Yeah.
So obviously a lot of very interesting things coming through. So let me just reload. Okay. So you mentioned butyrate earlier. So the first question was, how do you feel about butyrate supplementation?
I think I would say, look, absolutely. I'm all for targeting and using the right supplements. However, I would never neglect the food side because it's better technically. But ultimately, if we have patients who are definitively low on butyrate, either through symptoms or we see on testing, absolutely we would integrate it and use it. But I would use it alongside an education understanding of what are the high butyrate foods, beetroots, parsnips, sweet potatoes. Do both.
Yeah, great. Lizzie, thank you so much for joining us today. Well, I'm sure you're going to get some questions over the coffee break. Great. So, everyone, great. Okay, so we have 20 minutes for coffee. So, like Pavlov's dogs, wait to hear the bell, and we'll see you in 20. Thank you very much. Okay, everybody, please take your seats, enjoy your coffee, and of course there's going to be much more opportunity to speak and network over the break. So if you're now ready, we're going to go into our next presenter, which is Dr. Kamlen Pillay, and he's going to be talking about one-stop longevity, as you can see from the slide behind me. And I've seen his slides already, so this is going to be a great talk. So Kamlen, are you ready?
Yeah.
Okay, let's go. Thank you.
Morning, everybody. Dr. Ash, Seema, and the team, Julieta, thank you so much for having me here today to speak about what's certainly one of my biggest passions, which is longevity medicine and how we're creating a one-stop longevity solution in this world where we really need to redefine the science. But it's always wonderful being the first speaker after the morning caffeine break. So I know you're all energetic and wide awake. So I thought, in the spirit of keeping everyone's energy up, I'll start my talk with a little bit of a personal confession. But before we get into my confession, since you're all full of energy, I think I should make you work a little bit for my confession. So I just want to start with a little bit of trivia. Please raise your hands if you know who this guy is. Come on, guys. Is that all of you? I can share my coffee with you if you... Okay, so keep your hands up, please. Drop your hands if you don't know this guy. So everybody knows this guy also. It's quite interesting because a few years ago, 3 years ago, I actually gave a talk, and it was at that particular moment when everyone's hands dropped down because nobody knew who Brian Johnson was not very long ago. So it's quite interesting how the world has evolved and how rapidly it's evolved. But that wasn't actually the trivia that I wanted to ask you. My actual question was, what do you think that these two men have in common? And no, they're not Safirs like me. I'm from South Africa, by the way. We all know Elon Musk is originally from South Africa. Please forgive us for that, sorry. We apologize. But that wasn't the actual answer that I'm looking for. And before we get to the actual answer, I'll come back to these two guys in a second. If you don't mind indulging me just one more time, just for a few more moments, I'd like to try a small visualization exercise with you guys. So I want to invite you to close your eyes. No cheating. Please close your eyes. And I can see some eyes open. Some cheaters in the audience. So I want you to start visualizing a world where every man, woman, and child has the agency over their health, their time, and their money. A world where every person has the dignity of choice of where they live, work, and receive their medical care. A world where we go to hospitals, not when we're sick, but to stay healthy. A world where each day we use our energy to collectively leave the world in a better place than where we found it the day before. Now open your eyes. I'm sure most of you had visualized some utopic world. Yet, we can't deny that the world we live in looks more like this. Now, the real question is, how do we go from a world that looks like this to the world that we visualized just now, which should look more like this? So I'm going to let you ponder on that question for just a little bit longer. Can we have the volume up a little bit on the videos? Can I do that from here? Or if it's possible. So let's get back to these two. What do they actually have in common? Well, love them or hate them, you decide. But they both boldly announced that they will do or attempt to do what no other human being has ever done in the history of mankind. And so Elon wants to go to colonize Mars. God bless his soul. Brian doesn't want to die. So to the hecklers in the audience, in the crowd, they'll usually go, why should we go to Mars? Who actually wants to do a Duncan MacLeod and live forever? Why should these trivial pursuits be important to us who are supposedly the custodians of healthcare? And so this leads to my confession. Secretly, I actually do admire these guys. I admire their audacity. People like Elon and Brian, who, are consciously trying to shift the world in their own particular way. Because I too often get criticized by my medical colleagues for dedicating my time and energy to the pursuit of health span and longevity. My colleagues usually go, but Cam, those are rich people's problems. Why don't you focus on fixing real diseases? People are dying. And yes, they are dying. It's real. They do have a point. But to these cynics, I usually say, if we don't stretch our imaginations to the depths of its limits, we will fail to succeed. And this is important because, and I want to repeat that, if we don't stretch our imaginations to the depths of its limits, we'll never fail into success. And so, what do I mean by this? Well, if you think about all the great discoveries in the world, from Marconi and the radio to the Wright brothers and the lighter-than-air aircrafts and Edison and the light bulb, which, by the way, all of these things now are just commonplace and we take it for granted, unless, of course, the airports are on fire and planes can't land, and then we realize how important flying actually is. But all of these visionaries, these people all suffered great condemnation before their discoveries changed the world. And so my pushback to those who call the pursuit of longevity as being fickle is to say that, for me, longevity is to healthcare what Formula One is to motoring. Now, what does that mean? If you think about all the great motoring discoveries and the R&D that goes into motoring, ABS braking, seat belts, paddle shift gears, they didn't start in the Kia Picanto, right? They started in Formula One. And so when we use the areas of research and development to push the boundaries of where we're going in whatever industry it is, we need to really push the boundaries. Why make a car go 500 kilometers an hour? Well, it's to make sure that the car that's going at 120 kilometers an hour can be safe. And so when we push the boundaries of human existence, we start to find discoveries in areas that we didn't actually know we needed to find those discoveries. And that's why longevity is so important to me personally. And so when we think about longevity and we think about the hecklers and we think about the people that call us, wasting our time, it's important to understand why we're here and why we're doing what we're doing. And so the argument shouldn't be whether we should be trying to make people live longer. It should rather be, how do we make those extra years meaningful, joyful, impactful, and disease-free? But why? And I just spoke a little bit about the why, and it's important again to re-emphasize why, and to think about the why, and why all of you are here interested in longevity. What is your why of wanting to be involved in an area of medicine and life that's going to really change and shift boundaries right now? It's happening as we're speaking. So why and how do we help people to live longer and a healthier life? Well, if you think about healthcare as it currently is, it's actually sick care. And so when the system is totally sick, there's so many problems with our current healthcare system. And I'm sure each and every one of you will tell me, you'll wax lyrical about all the problems with the NHS or whichever health system that you're currently involved in. And so we know there's problems, and I don't even know where to start with the problems. But one of the biggest problems we have is that conventional healthcare is expensive and it's ineffective. And if you're in America, it's great business if you're in the business of bankruptcy. Because 2 in every 3 bankruptcies in America is due to medical bills. Now, if we don't see this as a problem, then we have a problem. And so this problem is not endemic to America. It's actually in all the Anglo-Saxon countries. If you go to Canada, you come here to the UK, we're suffering the same problem, where medical bills and access to medicine is so limited that when you actually need healthcare, it's not available to us. So we spoke about affordability as being one of the issues with the problems in the current healthcare system. I'm sure most of the medical people in the crowd will be familiar with this slide on the challenges that we have in healthcare around the A's. And there's clearly more problems in the system than I have time for today. And I didn't come here to speak about the problems in healthcare, and you certainly didn't come to listen to the problems that we're having with conventional healthcare. So I don't want to dwell on the problem slides because, frankly, they're quite depressing. So I want to talk about solutions. And to me, it's clear. In order to change and innovate and solve problems, we have to be audacious. And so someone once said to me, or I think I might have saw it in an Apple commercial, those who think they are crazy enough to change the world are usually the ones who do. And so you see, only audacious thinking changes the world. And for the cynics amongst us, you know, Roger Bannister was repeatedly told that his heart will explode in his chest if he runs a mile in less than 4 minutes. And so those are the limitations that we've always been forced upon us. And so it took the audacity of people like Nelson Mandela, Martin Luther King, to have a dream to change the world. And because if we're not audacious and try to change the world, then we end up in a situation like this.
Yes, what you see. Iceberg, right ahead! Thank you.
Might look familiar to you, it's a scene from the Titanic, but it could easily be a scene from your next visit to the ER.
Hey! Bullet time!
So the truth is, we deal with shipwrecks in conventional healthcare every day. Because when you sail your ship into the deep blue ocean without a map, without a navigation tool, without a compass, without a telescope, chances are you're going to hit an iceberg. And so this is how we practice healthcare. This is how we all actually live our healthcare journeys. We don't have a map. We don't have a plan. We don't know where we're actually sailing to. Now, imagine if we had the tools. Imagine if you had a compass, if you had a GPS, if you had a telescope. All of a sudden, you can see the icebergs 25, 30 kilometers away. You can see the island 40 kilometers away. And all you have to do is make one minor adjustment on the rudder of your ship, and you sail past the iceberg, and you say, bye-bye heart attack, bye-bye cancer, bye-bye diabetes. And so if we really want to be able to avoid the icebergs, we need to know what are the causes and what these icebergs actually are. And if you look around the world, you know, the Pareto principle is the 80-20 rule. 20% of diseases causes 80% of mortality and morbidity, and the number one killer that we know globally in the developed world is heart attacks. And so are heart attacks avoidable? Number two is cancers, and lung cancer is the biggest killer amongst all of the cancers that exist. So if we ask ourselves, are these diseases actually avoidable? And we actually know now through epigenetics and methylation that 80% of all non-communicable diseases are lifestyle-induced, which means by definition, they're avoidable by changing lifestyle and behavior. And this is very important because if you look at, for example, breast cancer, this lady went for a mammogram 3 years in a row, 2011, 2012, and 2013. And only in 2013 were we able to pick up with conventional screening that she had cancer. And by this stage, it had already gone to stage 2. If we had the benefit of AI, the same scan would have been read, and on the initial scan, you'd see that the cancer would have been picked up. So these tools now exist. We've got the telescope. We can see into the future. And this is what's actually driving the change in how we're going to crack the code of longevity. And so this is very important because I'm sure all of you know this. Early detection is key. When we pick up cancers in stage 1 or in situ, the 5-year survival rate is close to 100% in prostate cancer and in breast cancer. And this is huge. It's not just about mortality and morbidity. It's also about the spend. Once we move into stage 2, the spend below the curve becomes exponential because now it's chemotherapy. The direct costs of care exceed what we're actually able to pay. And so this is why we have the limitations in access to healthcare. So picking up cancers in stage 1 is critical. A stitch in time, as we know, saves 9. And so these are stats that we can't deny, and the data is clear. So healthcare, as we know it, is currently shipwrecked. And so if we keep giving the metaphorical cough syrup to a patient with TB or cancer, we continue to treat symptoms and we don't treat or prevent core issues. And then I think we'll all agree that we're just continuing symptomatic sick care and we're not really helping our patients to be healthy. So if you think that being healthy is just the absence of disease, then I want to challenge you to think again. And just like Dr. Ash said, it's not about living longer. It's about how do we create more health and health span in those additional years that we're going to live. Because it's clear, we are all going to live longer. There's no doubt. If you're around in the next 20 years, the chances are that you'll live beyond 100 is almost guaranteed. Because medical science is developing in a way that is unfathomable to every single one of us sitting in this room. In fact, none of us can predict what's going to happen in the next 5 to 10 years. So if we truly want to shift health span and create true longevity, we need to do something different. And so what's the answer? Maybe a different perspective. And another confession that I have is that I enjoy climbing mountains. So when there's very little O2 in the air going to my brain and my legs are sore, I come up with these air-brain schemes. But we do have the tools to solve the iceberg conundrum. And if we think about it, we have genetic testing, which is the equivalent of your map. It gives you a direction of where your health is actually going. For the telescopes, we've got incredible screening tools. For the compass, we've got advanced AI. And for the ship's rudder, to control the direction in which we're going in, we've got epigenetics. And we're starting to understand methylation and the methylation of genes in a far more realistic way than we ever did before. So it's just about making the right choices in your lifestyle and embracing all of the information that some of the other speakers have given us before. So how do we shift these paradigms? And is it actually possible to live a healthy, long life today and in the future? I say, yes, we can. because the Japanese are showing us that it's possible. Maybe you guys might not want to humor me one more time, but who knows what's Ikigai? And no, ladies, it's not the guy that was hitting you in the pub last weekend. So, Ikigai is the art of living a balanced and beautiful life, in summary. It goes into much more detail than that. And the Japanese, with a population of 120 million people, 80 years after being bombed, have one of the healthiest populations in the world. So to crack the code of longevity, we don't have to look so far. We just have to look at the factors of what's influencing the health span and the lifespan of these people on the other side of the Pacific, and that's making up their blue zone. So the key that we learned from the Japanese, the first key of unlocking lifespan, the lifespan conundrum, is clearly that preventative health screening is one of the key pillars of what we have to be doing. And so to me, I say prevention right now is our only reasonable cure. Early detection and intervention is key. A stitch in time, as I already said, saves 9. And so the jury is out on this. The scientific evidence is unequivocal. Preventative health screening is not only more cost-effective than conventional healthcare, it also goes far more than just cost saving. And I'll talk about these advantages a bit later on the slide. The next the next key to cracking the code of healthcare or well-care builds on the Ikigai concept of creating a new holistic, integrated model on the pillars of your health, your time, and your money in that order. Because if you put money first and not your health first, then the entire system collapses. Think of Steve Jobs. All the money in the world died in his 50s. And so if we want to change the system from sick care and move away from the disease-centric model that we have, we need to realistically build all of our models on these 3 pillars. And so we came up with something new, which is what we call WellCare. And this is our one-stop longevity solution. WellCare is not just an upgrade on our current healthcare system. It's a complete overhaul. Because we coined this term because we felt that healthcare is not serving us well enough anymore. It's a system that's broken and it's associated with sick care. And when we think of wellness, it has this sort of woo-hoo, touchy-feely type of connotation to it. And there's no real empiric data, because what is wellness? And so we needed to create something that bridges these 2 worlds, that's more scientific, and that's a conscious shift away from the reactive sick care model to the proactive, preventative, precision well-care. And so this is how we're building the one-stop longevity solution. And so I call this the lifestyle model of medicine, because it's really built on the science of epigenetics. And if we can literally use our lifestyle, which is our nutrition, our exercise, our mindfulness, as our medicine. And it's built on this biopsychosocial model. In fact, Hippocrates alluded to it many, many hundred years ago. He said, let thy medicine be thy food, or thy food will be thy medicine, something like that. I think I butchered that, sorry. But I believe it goes beyond your food. I think he should have said, let thy lifestyle be thy medicine, or thy medicine will be thy lifestyle. And so if we want to build a model, we need to leverage all our tools, from quantum physics to AI technology, to all of the various different things that we heard about today, mycology, gut microbiome. These are critical things that we were never taught about when we went to medical school. It's now becoming mainstream. And the reason that it's becoming mainstream is because it works. And the science is backing it, and it's becoming more and more robust. So what we did to support WellCare is we built a phygital platform. The word phygital we coined as a combination between physical and digital, and using digital strategies to underpin the physical locations in which we treat our customers and our clients, and connecting these platforms globally so that we give us as global citizens the best opportunity to have a personalized WellCare program. And so this is what our longevity model looks like in action. It starts with precision screening and diagnostics. It moves on to personalized, integrated, allopathic, and lifestyle interventions. So we're not throwing the baby out with the bathwater. We're not saying that allopathic medicine is bad. It has its place, like Dr. Ash spoke about earlier today. And then we're adding in regenerative therapies, including things like fresh stem cells and all of the other components that we spoke about earlier. So to do this, we had to build a world-class digital technology stack. And so all of this is underpinned by our technology. And I sped this video up a little bit, so if this lady sounds a bit like Alvin and the Chipmunks, I apologize for that. But
with each new
I think
day,
you'll get the gist.
healthcare is transforming rapidly. This shift from reactive sick care to proactive well care is reshaping the way we experience and deliver healthcare services. AI technology and vast population data are profoundly enhancing our diagnostic accuracy, which paves the way for holistic well care approaches that are patient-centered and anticipatory in nature. Decentralization of individual health data is ushering in the economy 3.0. For the first time, you can have absolute control over your medical data and health journey. Introducing the health data economy that is reinventing the medical data landscape with a decentralized blockchain platform. Individuals, medical institutions, and researchers are now all connected in a secure ecosystem that facilitates secure data sharing. Digital medical cards allow the analysis of various lifestyle, genetic, and environmental factors to produce essential well care predictive plans. Expert medical practitioners, health clinics, and insurance providers can access and update your medical wallets in real time, developing personalized treatments that provide coordinated care. The InU app allows you to access all of your medical data dashboards, smart devices, activity tracking, medical aid claims, prescriptions, lab test results, X-ray imagery, medical records, and hospital visits all in one complete comprehensive solution. Health information that is precise, easy to understand, and up to date on a new ID with a compliant digital profile. Earn well coins for proactively managing your health, tracking goals, and sharing data in the network. Your healthcare data now takes the form of a revolutionary digital currency, empowering you to extend your health span and live well for longer. Download InU app and put your health in your hands. The InU app is designed to be a one-stop shop for all your health and wellness needs. Patients, medical staff, and specialist doctors can benefit greatly from interacting with the InUL platform. Take John, for example. John is relatively healthy for his age, but he has noticed he doesn't have the energy he used to. He's overworked at his job. He needs to ensure that he won't be on his way to a burnout. Mentally, he finds visual signs of stress with breakouts on his skin, and his digestive rhythm is not as regular. His father also recently had a heart attack, so he is more conscious of his health and the importance of monitoring this. He registers on the InU app and starts his DNA-driven InUL journey. The app includes personal DNA analysis, booking for virtual and in-person consultations, practitioner collaboration, curation of personal, mental, and physical well-care journeys, wellness tracking, and self-screening tools. John is able to use the InU app to order a DNA test kit, making the entire logistical process easy to manage from within the app itself. John's DNA report with recommendations is available on the app. He finds out that he is at risk for lipid metabolism, inflammation, and may have insulin sensitivity. John chooses to do a personal consultation at the flagship InUL Institute at the V&A waterfront. John completes a medical questionnaire and gives consent for his electronic health record, fitness data, mental wellness info, and emergency contact information to be shared with InUL and other practitioners at InUL. John is provided a list of InUL practitioners based on his conditions. He can use this tool to find the practitioner that he feels most comfortable with and has the expertise to help with his specific conditions. He books a consultation with Jane, an InUL practicing dietitian. John's electronic health record is created based on the medical questionnaire and third-party data integrations. This is great for John and collaborating practitioners, ensuring all consults are done using the central and up-to-date information at hand. Welcome to InUversal Data, the collective of medical and supplementary data, fueling InUL's eye and predictive medical models. Once John's electronic health record is created, Jane, the dietitian, looks up John's patient profile, which includes his DNA report, health history, exercise, routine list of symptoms, and noticeable conditions. Jane realizes that as soon as she works through John's profile, the more InUL practitioner points she earns. Jane is also a loyalty point earner, like John. With many self-screen options available, John decides to use the self-screening feature on the InU app to take scar and mole mapping images of his back, and shares this with Jane before his consultation. We see a WellCare program being curated for John to follow. This will assist in the proactive healthcare plan based on his DNA results. John has the ability to earn more points and rewards along the way. During his visit, Jane walks John through the DNA report and examines John's breakouts and symptoms. She recommends that they introduce a second practitioner, Dr. Mike, a dermatologist, to assist with the case. Together, they suggest additional tests and curate a treatment plan for John. Using the customized WellCare curation engine, this provides a holistic plan for physical, mental, and emotional wellness. Having received his latest test results, John schedules a follow-up appointment. John's test results come back negative for melanomas and skin cancer, but the InU app can help him continue his well-kept plan to ensure his journey to optimal health. John's treatment plan is now available to him via the app. He has the ability to track his individualized wellness program with regular reminders and notifications, earning more InUL rewards for each milestone reached. To ensure smooth practitioner collaboration, Jane and Dr. Mike have agreed their rates for their services. It will be processed by InUL through the use of smart contracts for efficient patient management. Sally and her team are able to track and fulfill cash and medical aid payments for Jane and other subscribed practitioners at the InUL Institute. At the end of the week, Jane is going to bed on a Friday evening. She checks that InUL will report reviewing her patients seen, fees generated, status of a medical aid claim, and reminds John to continue his WellCare plan as she can see him falling behind. John is impressed by the InUL solution and refers you InUL to his cousin Mary in Europe. ULGO is InUL's medical travel platform. He suggests one of the packages to Mary. John decides to go to bed checking his WellCare progress. He has a few minutes to spare and browses through the InU app features to initiate a request for a WellSurance premium quote, and thereafter picks up an article to read. Introducing proactive WellCare with the InUL suite of apps, bringing value and medical innovation, collaboration, and efficiency in practice management to all InUL stakeholders.
So I'm not going to go deep into this slide because I just got warned for my time. But my CTO will do a much better job explaining this. But what I wanted to actually say on this slide is that collaboration is one of the major key factors in building a technology stack. And we're working with some incredible brands globally, multinational companies that are collaborating in our technology stack. And for the techies in the audience, this slide might excite you. But I only included it again to show the importance of a robust technology solution when we're trying to treat our patients and create longitudinal data, because constant data is very important in how we direct our customers' journey. And so in the app, users can own their own data, collaborate on their health matters, both with their practitioner and with their peers, and access their personalized health span protocols. And they can also get real-time feedback from their wearables and so forth. So all of this is backed by the International Foundation of Integrative Medical Research. So everything that we're doing in our health span protocol from a longevity perspective is all science-based. We've got collaborators from all over the world, from places like Oxford, Harvard, top universities in India, IIT, Thailand, South Africa. And the advisory panel is really about clinical validation, global collaboration, ongoing R&D in integrative and regenerative and preventative medicine. And so by working with people, leading people in the world and leading scientists, and also people like you in the audience, we're here to really seek and realistically expand the world's blue zones. So it all comes together in a one-stop digital reality longevity shop. And I believe that the science doesn't have to be redefined. It just has to be exposed. It's always been there.
We live
so
in an
this
era
is our
of medical complexities
one-stop shop
and
that
uncertainties.
we built in South Africa.
Yet the spaces where we search for solutions are no longer aligned with our needs. We desire transformative experiences rather than mere transactions. Sustainable healing instead of inefficient practices. Introducing InUWell, a groundbreaking medical and WellCare destination in the Cape Town waterfront, pioneering the paradigm shift from reactive healthcare to proactive, predictive WellCare with renowned medical experts, AI diagnostic screening and testing labs, specialized treatments and therapies. InUWell's versatile multifunctional design and forward-thinking commitment to radical sustainability offers consumers an unparalleled experience that is a seamless blend of physical and digital realms. We are revolutionizing the WellCare landscape globally with Active Health Studios, the country's largest immersive digital exhibition space, and DNA Precision Dining. With curated partnerships, we're giving brands the opportunity to push beyond conventional boundaries and create meaningful connections with their communities through a sensory-rich digital reality. Be a part of the WellCare revolution at Amy Well and join us in shaping the future of health and WellCare practices, retail, and immersive experiences.
So, what are the 5 things that we could all do to start embracing our own WellCare journey and our own health span journey? I think the first thing we need to do is we need to start by knowing. Get tested, know your risk for certain non-communicable diseases, check your biomarkers, and have a DNA test to know what those risks are. To see an integrative specialist to personalize your own healthcare journey. Track your markers consistently. You need longitudinal data, not cross-sectional data, as we currently do in healthcare. You can use wearables, there's amazing rings and watches and so forth, and invest in preventable therapies like we spoke about earlier. And I think lastly, adopt a WellCare mindset. Be proactive, be curious, and be consistent. And just to end, our bodies are an intricate ecosystem. The better we get to know our body, the longer and stronger it will thrive for us. Remember, we're all the captains of our own ships, and we know that we now have the instruments to avoid those icebergs and navigate ourselves to safe waters. The future is not just about adding years to your life, it's about adding life to your years. Thank you.
I mean, what we're seeing, Cam, would you mind just answering one question for me? We've seen a window on the future there. Obviously, the complexity of everything that you've just shared with us is a heavy lift, right? So where are you now? How soon are you going to go live with this?
So we've got MVP versions of most of the tech that you've seen. And we're collaborating with multinational companies from Japan. In fact, I'm on my way to Japan after this. And it's through forums like this that we create the collaborations and meet like-minded people that want to contribute to a global solution. So we are, as I said, in various stages of beta mode testing with certain aspects. And the 1.0 version is already launched. We're working already with the system. And we have a 2.0, 3.0, and a 5.0 version that we'll get to, which effectively uses the data modeling and the ML machine learning and AI models to be fueled in the future.
Great. Yeah. And one last question. I saw insurance there. So are you working with the insurers on building this?
Yeah, 100%. South Africa has a very robust health infrastructure, insurance industry. We have a number of lives that are insured, and so the biggest benefactors of health data is going to be the insurance industry. Right now, the medical life underwriters are using models from the 1970s. So new health data, especially on healthy people, which we don't have. There's a big black hole in the world in terms of training AI models. We've got a lot of data on sick people from the schooling system with our kids, and then once we leave school, there isn't much data on healthy people. And so we then get data from hospitals and clinics. And so if we want to train AI in order to be able to give us the right answers, imagine if you had a GPS. I don't know London well, so I'm going to use the South African version of the story. But if you wanted to go from city A to city B, which is 100 kilometers apart, and 50 kilometers down, there were no data on the roads in your GPS. The GPS AI would take you all the way around and give you a very convoluted route to get to your destination. And that's what's happening in healthcare right now with AI. We don't have a lot of data amongst healthy people. And so preventative health screening really solves for that, because we get the data that we need to be able to train those machine learning models much faster.
Okay. Well, please thank Cam again. That's wonderful, Cam. Thank you so much. Okay, so we've got very much a change of pace now. So we're going to be doing a breath workshop with Alan Dolan. So Alan, are you ready to come and join us? Okay, good to see you. Nice to see you. Would you like this, or would you?
Yeah, I might.
Yeah, I'll leave this.
Hi, everybody. Good one. There you are at the back. Come on at the back there. Yes. Okay. So I had a great speech planned. It had all sorts of stuff in it. It had Tibetan theology. It had giant tortoises from the Seychelles who only breathe 4 times a minute and live for 200 years. And then Ash said, forget all the physiology, just get to the good bit. So I think that's what I'm going to do. So I want to let you know that I've been working with breath for about the last 30 years. 8 years was with the pranayama, the breath aspect of yoga. And the last 22 years, I've been working with a form called conscious connected breathing, which is still fairly new. It's just coming into the zeitgeist now. And I wanted to give you a first-hand experience of it. But in order to do that, I just want to give you a little bit of context. So I was working in Riyadh 30-odd years ago. Riyadh is quite a draconian place at that point. I was working in the military. It was BAE Systems, GC and Marconi. And it was a pretty militaristic environment, let's put it like that. I did not really fit, so my stress levels were going through the roof. I was smoking a lot, I was drinking a lot. I was in PR and communications, and my nickname was Tree Hugger within the community. There were 1,200 men in the head office there, and I started to do yoga. Yoga rocked my world. I did it because I wanted to relieve stress levels, but it did so much more for me. It really opened up. It was so multifaceted. It had physiological benefits. My stress levels did indeed come down. But it also opened up a kind of a mysterious liminal space that I knew nothing about. I was not particularly spiritual. In fact, I'd gone through a period of being a Marxist. So when I got to yoga, it kind of surprised me. So, long story short, I took a sabbatical, and the sabbatical was really to go and explore more about how I could relieve stress, how I could help other people to relieve stress, and also just to explore this liminal space that I'd sort of connected with. So, the rumor going around the office, the 1,200 guys at BAE Systems, was I was leaving to do a master's degree in aromatherapy. That was not true. But I took the year out. I didn't really have a plan. I just trusted that the universe would present whatever it needed to do. Whatever I needed to do would be presented to me. And I remember saying before I left Riyadh, make it really obvious. Don't make it ambivalent. I want to really know, or ambiguous. So I got to Costa Rica, and I was doing a yoga teacher training. And it was lovely. It was exactly what I love to do. But in the middle of it, we had a day off. And there were 2 American guys there, and they said, we've got this thing called conscious connected breathing, and we'd like to give you the gift of it. And I remember being less than gracious. I was a little sniffy, actually. I'm a yogi, baby. What have you got to teach me about breathing? How wrong was I? 45 minutes later, the world was an entirely different place. And I think the takeaways were, A, I was connected to something. It allowed me to connect to something much bigger than myself. I didn't have a name for it, but it was a huge connection. I had a lot of energy running through my body. And I got some information that I'd previously not had access to. And the key of the sort of core of the info was I got what I now call my inner teacher telling me, you've been depressed since you were 12. I was like, what? I was 40 at the time. And it was like the missing piece of the jigsaw puzzle just floated into the picture. And I don't know if you've ever had an experience of having a sort of a bodily knowing. It wasn't a cognitive knowing. I got it through my whole body. And it was like, holy shit, he's right. Whatever this thing is that's talking to me is right. So, and then it said, and you can release the underpinning of what's holding your depression in place if you practice this on a daily basis. So I did. And I should have had shares in Kleenex. There was a lot of tears, there was a lot of tissues being used. But 12 weeks later, whatever that underpinning was had gone. And I was a different person as a result of it. And of course, when you find something that works so well for you, you want to share it. It's a very human trait to share the good news. So that's what I've been doing. And I built a company, and the company is called Breath Guru. So the idea with Breath Guru was very simply, you are the guru, your breath is the key. And I remember when the name came in, I was meditating at the time, and it dropped in, and my ego said, they'll think you want disciples. And I absolutely do not want disciples. The whole point of breathwork is it's self-empowering. It's about you picking up the ball and running with it. So today, just listening to the other speakers, it's given me a couple of different perspectives. But one of the things is that we're all doing the same thing. It's a diamond, and we're all coming into the facets of the diamond from different directions. One of the things that I've noticed about the physical aspect of breath is that we are not in our bodies, generally. Most people on the planet are living in their heads. They're not embodied, they're not grounded. So one of the things I love about breathwork is it can drop you into your body very effectively, and that's one of the experiences I'd like to share with you today. The second thing is we are carrying around our unprocessed mental and emotional history within our bodies. And one of the things that breathwork can do, this particular form I'm going to teach you today, is it can open up the subconscious. There's something, a lovely term called transient hypofrontality, would you believe, which means that the prefrontal cortex gets less oxygen. And when that happens, the prefrontal cortex is almost like the gatekeepers to your subconscious. So when it gets less oxygen, it works less effectively, and you could say the gatekeepers or the sentinels fall asleep, and you can access this previously inaccessible material. So that was what was happening when I was releasing all that stuff in the first 12 weeks of finding this technique. We get these windows of opportunity whereby we can release our baggage, essentially. So I just want a quick show of hands. Who does not have any baggage in the room? Yeah, we've all got it. You know, doesn't matter how evolved you are, doesn't matter any of that. We've all got stuff that we need to process. And I had a guy that I interviewed the other week. I do trainings. I train people to do this work. And I had a guy that I interviewed, and I told him about the program, and I told him that, you know, I'm going to teach you how to be a breath coach, but I'm also going to work with you to release your unprocessed material, your baggage. And he's like, he was only 23, bless him, and he said, I love the how to be a breath coach bit, but the baggage bit, I went on a weekend retreat a few weeks ago, and I think I'm done. You know, and I was just like, whoa, okay, he's not my man. So we do get these windows of opportunity. I have yet to find anything that's more effective at accessing and processing our unprocessed material. And one of the key sort of fundamental concepts is our breath is how we process our emotions. So when we go into fight or flight, freeze, fawn, we're not breathing, and therefore whatever that emotion or feeling is gets filed away in the body until such time as it can be released and reprocessed. So just on the physical level, there's just two other things I want to say. We're not in our bodies, but we can be. Thank God for neuroplasticity and our ability to change. Two, most of us are breathing in the upper region. We're upper chest breathers. Once you drop down into your belly, which we're going to do today, then things begin to get really interesting, and particularly the use of the diaphragm is super important. And then the final thing on the physiological is simply that most of us have an overtoned core. And if you do yoga or Pilates and stuff, you've probably heard about, you know, core strength, and I need core strength to bring my back into line. But actually, a lot of us are walking around with real tight core, and that's a problem, because what it means is that, I think you can still hear me, it means that when you breathe and your energy comes down, if this is too tight, it can't drop down to the lower part of your body. So it means we're sort of half in and half out. So one of the things that is becoming quite popular now, certainly in London, there's a lot of people who are specialising in core massage. That's a great thing to do. Am I moving out there?
There's the microphone just in front of you.
Sorry. Don't forget the obvious. Okay, so the core area for most of us is quite tight. So if you can just begin to breathe in the abdomen, you can begin to release and unwind that area. The third aspect, we've got the physical. We talked a little bit about the mental, emotional. The spiritual or the metaphysical. I was just talking to my friend there next to me in the seat, and he was saying, you know, I don't really have any particular beliefs, and it's not necessary to have any particular beliefs to do this practice, but it does connect us to something that is greater than ourselves. I call it God. Doesn't matter what you call it. Sometimes I call it Derek, just because God seems to be quite a loaded word for a lot of people. So it doesn't really matter what you call it, but we're in an intelligent system. That becomes really clear when you start to explore. The system is intelligent. There's no dogma, there's no theology. It just is. And when you begin to explore this, me as a former Marxist, it was quite surprising. You know, you have to kind of maybe grow your paradigm a little bit. So enough of the talk. I want to get you doing it. I just want to let you know that there's going to be three parts to this. The first one is a grounding exercise to bring us into our bodies. The second one is an abdominal breath, just to get the diaphragm moving. And the third one, we're going to connect our breath. And by connect our breath, what I mean is we're going to flow the breath without pauses. A connected breath is simply a breath that's always in flow. If you are prone to epilepsy or fitting, if you have a history of severe mental illness of any description, any kind, if you've had recent eye surgery or you have cataracts, do not do the third aspect. Just stay in the second zone. I'm going to talk you through it. If you're trying to get pregnant or in the first trimester of pregnancy, equally don't do the third aspect, the third zone. For everybody else, super safe. One of the things that happens when people start to do breathwork is they probably try too hard. So I get a lot of people coming in and they're kind of that. It's totally the opposite. If you are doing this correctly, it's a super chilled out breath. It should not feel strenuous at all, and you'll still get the results. Less can be more. So the first thing we're going to do is the grounding. It's a visualization. It doesn't matter whether you see or feel anything. The main thing with the grounding is to keep your attention on your feet, and it'll work. The second thing is an abdominal breath. Now, I'm an abdominal breather, so it's relatively easy for me, and 20% of the people in the room will be abdominal breathers. But for those of you who are up top and you're generally breathing in the upper chest, you might find that it feels a little strange when you first begin to do it. So it's super simple. You simply put your hand on your tummy, imagine a balloon in there, and just when you inhale, you inflate the balloon. So in is how we remember it. So if we just take an inhale and inflate, and then let it go. It's as simple as that. The third aspect, we're going to keep the abdominal breath going, and we're going to be breathing with the nose, but for the third phase, we're going to shock horror, open the mouth, and we're going to breathe through our mouths. Now, there's tons of stuff out there. If you read the James Nestor book, there's loads of stuff around. You know, the nose has hairs for very good reason, and indeed it does. But for our purposes today, with just a very short breathe, the mouth is going to be more effective at dropping you into the body. And really, that's what I want to give you a sense of. We're not going to go into too much of an altered state, but I do want to give you a sense of being more connected to your body. And of course, this feeds into everything we've heard this morning in terms of our quality of life and our understanding of what's going on in our bodies. I worked with a trader a couple of weeks ago, and he'd been having the Heimlich maneuver literally twice a week. He was choking on his food. He was that stressed. And I had a little chat with him before our session. I said, you know, where do you think you are on a 0 to 10? 0 is no stress, 10 is lots of stress. And he went, I'm about a 2. He was about a 15. He was off the chart, but he couldn't feel anything. Couldn't feel anything to it. And his body was like that. It was marble. There was no give in his body whatsoever. It's just totally held in. So the more we understand about ourselves, the more we can feel our bodies, then we can avoid the icebergs and become healthier and happier. Okay, so let's just close our eyes initially and take your attention to your feet. If you're holding on to anything, pop it down. Just make sure your hands can be in your lap. Just make sure you feel kind of comfortable. If you need to shimmy a little bit in your seat. We're going to take our attention to our feet and just feel the connection that your feet are making with the floor. And as we said, this is not about having to see anything or feel anything. We just want to keep our attention on the feet. If you notice you're up in your thoughts or your imagination at any point, that's okay, but just bring your attention down to your feet again. So we're feeling the connection to the floor, and we're going to send an energetic root down from the arch of each foot. Those roots are going down through the floor into the earth. And off those initial 2 roots, send lateral roots off in every direction. So you've got a little mini root network emerging from each foot. And then merge those 2 mini networks into one bigger network and send that to the center of the planet. And again, doesn't matter whether you see or feel anything. Just focus on your feet. Your roots are going to the center of the planet. They're heading out far and wide in every direction also. Deeper and deeper and deeper they go. Heading out in every direction. And it's a little bit like the oak tree. You know, there's oak trees with huge big roots going down into the earth. We're a little bit like that. And if your roots are super huge, you're super connected to the planet, then just like the oak tree when the storm comes, it may move around a little bit, but it's nothing too much. It's not really a big problem. Humans are a little bit like that. So we want to just deepen the roots, go all the way down, deeper and deeper, grounding into the earth, connecting into the planet. And not only are we deepening our connection or focusing our connection with the earth, but we're also receiving earth energy, and that's dense, it's heavy, gravitational energy that's coming up through our energetic roots into our feet and subsequently our body. So deeper and deeper we go. The roots are filling the entirety of the earth now, and you're this teeny tiny little human on top of the planet, connected to this enormous root system that's full of heavy, dense earth energy. So just pop one or both hands on the lower abdomen now, and in and out through the nose. We're just going to go at our own pace. Don't need to synchronize with your neighbor, just inhaling, and as we inhale, we're inflating the balloon, and then we're letting go. Inhaling and letting go, and just feeling your abdomen inflate and let go, and inflate and let go. And the speed's not important, just go whatever speed is important, is appropriate for you. And with that exhale, just letting go of whatever it is that's been held on to. Any tensions in the body can be released with the exhale. Noticing how your body's feeling. We're not looking for anything in particular as you continue to breathe. Just stay in your awareness. Notice what you're experiencing, still aware of your feet on the floor. And then for those of us who are going to the third stage, in other words, not the contraindication people, just opening the mouth now and gently. And we're still breathing the abdomens, and then we let it go. And as we breathe, just see if we can open our mouths a little bit more and extend our inhale even more. Safe for me to breathe, and it's safe for me to receive. And making sure that your breath feels comfortable for you. Maybe opening the mouth even more. And you may feel like you want to yawn, or there might be sensations in the body, and whatever it is, you're just allowing that to happen. So we're inhaling, and we're letting it go. Then we're just going to close the mouth. Keep your eyes closed. Go back to the nose. Let your breath take care of itself. And just notice what you're experiencing. You might feel yawny. There might be some sensations. There might even be a few emotions around. Whatever it is, just allow it to be exactly as it is. Notice if your mind is moving slowly or quickly. Many thoughts or few thoughts. Notice your heart center, middle of the upper chest, any emotions or feelings that are discernible and present. And then just gently moving your attention all the way down, all the way down, all the way down to your feet. And again, just feeling that connection to the earth. We're a little bit like mobile phones, those phones that you used to have to pop onto the base. The earth is our base. We really want to be connected to it for optimum health. So just going to begin to wiggle the toes a little bit, wiggle the fingers a little bit. Small movements. Always come back very slowly, even when you've done a really short breathe. And then gently just expanding your awareness back into the room. And opening the eyes, coming on back. Okay, so we're not attached to any particular outcomes with this. For some people you might have been feeling sensation, for some people it might be a little bit emotional, for some people you might be like, who is this guy, what's he on about? That's fine. Whatever it is, it's absolutely fine. But just notice what you felt, and also just notice whether or not the mind went into it some kind of resistance. Oh, I can't do that, or I don't want to do that, or I'm not going to open my mouth. You know, very interesting just to explore who you are. I was talking with a trainee this morning, and we were talking about, we do a daily practice of 30 minutes usually, and he seemed to be saying it was some sort of obligation, and I was saying, no, it's not an obligation, it's communion, it's time when we connect with ourselves, you know, it's time, really sacred space, because we're so busy, and our lives are so crazy, and as we've heard about, we're just not designed for this. We're not designed to live in cities in this way we live. So our nervous system gets bent out of shape. So just slowing down for some minutes every day. If you can't manage half an hour, 15 minutes, do whatever you can do, but just some time. And just to say one more thing, I was lucky enough to work with a breath teacher that I call the Jimi Hendrix of breathwork, because she just took it to a whole different level. And the very first thing she ever said to me was, the nature of mind is insane. And I was in the States, it was like 50 of us, and I don't get that at all. But I was too intimidated to put my hand up, so I didn't ask her. Boy, do I get what she meant now. Look at the planet, look at what we're doing to it, look at what we're doing to each other. That's insanity. And why is that happening? Because people think they are the voice in their heads, that's their true identity. Newsflash, it ain't that. It's something different to that. And breathwork is one way that you can explore what your identity is. So have fun with it. I'm going to just give you one more slide. I have a bit of slide envy, actually, because I only had 2 slides. So if you take that one, you will get the website. And on the website, there's a download to the app. I built an app because I realized that even if I was working my arse off, I couldn't get to the amount of people I wanted to get to. So we've now had about 27,000 downloads on the app, and I made it myself, so of course I'm not entirely objective. I think it's amazing, but it will give you everything you need. It's got videos, so it will give you more context than I gave you today. Normally my workshops are about 3 hours, so this was the potted version. So the videos are just really worth watching, and then there's 2 audios with my dulcet tones talking you through your own breath practice. And the idea is take what we did today and then using the audios go deeper. And I wouldn't go deep straight away. I would just incrementally over time just add a few minutes. We probably breathe there for about 5 minutes max. The app is 30 minutes. So just, a week on 5, a week on 10. And I'm quietly confident you'll be finding stuff that maybe is surprising, enlightening, and that's the idea. And ultimately, you don't get more self-empowering than breathing, yeah? So again, don't want disciples, pick up the ball and run with it. And if there are any questions, though, please use the mechanism we talked about before. And it's been a total pleasure to introduce you to your breath.
That was wonderful. Thank you so much. So obviously you're running the app, but you also do private clients as well, stressed out traders.
If you want to do the 3-hour thing, we've got a workshop on the 28th of June here in London at a place called Indaba in Marylebone. And I also do teacher training